Welcome, everybody. Welcome to LAST, the Laboratory for Augmented Surgical Training. This is Professor Dr. Rodolfo Oviedo, CEO of TRUX, the Robotic Global Surgical Society. We are at the Intercontinental Training Program affiliated center in Nacogdoches, Texas, USA, one of 12 centers across the globe for the one global family of TRUX. So we're honored today to have the team from Moon Surgical, a company that arose from France and is an international company with headquarters also in the United States at the local level. And we have three of the leaders came all the way from California and from Dallas, Texas to assemble the Maestro system from Moon Surgical so that we can demonstrate the art of robotic simulation with the Maestro system today. So thank you very much. Just a disclaimer, we are a nonprofit society. TRUX is a nonprofit organization registered in France with members from almost every continent in the world. The official language is French, but also English due to the common language that most physicians and surgeons speak in order to get updated with the literature and advancements in science. And so we speak many languages, but we are one global family. We're proud to be here. We have multiple centers across the globe. We'll be talking about all of that. But without further ado, I'd like to introduce our guest today. But before that, I am the speaker, but I couldn't do this without my wonderful moderators. And so over here, we have student doctor.
Hi, my name is Brittany Bass. I'm a med student at Sam Houston and third year rotating with Dr. Oviedo this month and having a great time so far.
Wonderful. Now let's switch. And now we have student Dr. Michael Abraham.
Hi there, I'm student Dr. Michael Abraham. I'm also a third-year medical student at Sam Houston State University, College of Osteopathic Medicine. And I'm excited for this opportunity to learn with Dr. Oviedo, as well as learn about this new technology that we're about to see today.
Okay, excellent. So I'd like to introduce the team from Moon Surgical that is featuring the Maestro system today. So over here we have Tushar, who came all the way from California, from Silicon Valley, just to do all of this and to be prepared so that we can teach our audience, our global audience, how to learn from the Maestro system and how it can be beneficial not only for the hospital setting, but also for the ambulatory surgery center setting. Just another disclaimer. This is an event that is being sponsored by Moon Surgical for TRUX, not financially, but in terms of the equipment. We are a nonprofit society. We are not getting paid for this. This is being fully transparent. This is out of the kindness and generosity of Moon Surgical providing the equipment, not financially, but the equipment so that we can all teach our audience. So we're very happy and honored, and hopefully this will lead to a collaboration in the future in partnership for a scholarship fund. And we have also invited Moon Surgical leadership to be present at the TRUX Luxembourg Congress 2026. We're hoping for a positive response. But in the meantime, Tushar, who is one of the leaders of Moon Surgical coming from California. We have Victoria, also, who is a biomedical engineer, who's going to be explaining the hardware and the software from the Maestro system. And we have Kylie, who is a financial expert, also a soccer player, athlete, and a surgical technologist from the Dallas-Fort Worth area in Texas. So, guys, how are you today?
Yeah, we're great. Thank you for the kind introduction. Victoria represents our clinical engineering team. Kylie represents our account management team, myself on the product marketing side. So this is really the launch team and the team that works hand in hand with surgeons and staff members to bring Maestro to your institutions, whether it's academic, community-based, or ambulatory surgical center.
So something interesting, guys. Why some surgeons may be asking, what's special about Maestro? Like, look at it. It looks so small. I mean, it's shorter than any of us. It looks so compact. It doesn't look like the big robot that we're used to seeing, right? Or some replicas or some other variations of the same system that we always see with a very large boom, very massive build-up. Now they make it more compact, but still multi-ports, multi-arms, or even single port, but open console, closed console. Would you say this is really a robot? Number one question we have is people say, is this a robot or not? What is it? Is this true? Is this truly robotic surgery? And how can it benefit me as a surgeon and my patients? What's special about it? What would you say?
Yeah, no, it's a fantastic first question. And really what we are is an AI-powered surgical platform. And that encompasses a broad clearance as well, from both the FDA and the CE mark. We have approval for all laparoscopic procedures, whether it's a general, a bariatric, oncologic, It's all there, colorectal. That's what it enables. As you can see that this is a 2-arm cart basis. There isn't another console. There isn't a separate piece of equipment that you need to manage or be holding to. You are going to be operating at the bedside. So it is designed for straight state laparoscopic procedures where you have control of your workflow, stability with your instrumentation of your camera and your retraction, or if you're in guide, we're exploring that option for the computer manipulator as well.
So you mean that it's not only for laparoscopy, or you could argue that it's not just a robot, it's really a device that could be used not only for laparoscopy, with all indications for laparoscopy, by the way. Everything laparoscopic could be done with this system, and it has the Food and Drug Administration FDA clearance for anything laparoscopic. But you could say that it could have future applications for gynecology, for uterine manipulator, and maybe in the future for open surgery for retraction of certain organs. Maybe, who knows, right? So, because it's really not a device, Victoria was explaining this to me last night, that is not a device that introduces anything into the body. If you think about it, it's a device that's outside the human body, and you can connect it to anything that you would normally use, right, Victoria?
Exactly. Yeah. So one of the key features of the system is that it's compatible with off-the-shelf instrumentation. Everything from the camera unit, laparoscopes, the instrumentation you use, and the CCU and towers you use, whatever you currently have, Maestro can accommodate. So that's something we'll show actually in the demonstration.
And kindly, what about the AI? What about AI? Everybody knows about. I remember being at the 6th World Congress for IBC, International Bariatric Club at the University of Oxford in September this year. Everybody was talking about the interesting relationship or alliance or partnership between Moon Surgical and NVIDIA, right? One of the most successful companies in the world on AI. So what's special about what do we need to know about Moon Surgical and NVIDIA and the AI platform that it offers?
Well, obviously, you just mentioned it. We partnered with NVIDIA, which is great, right? I think everyone knows who they are or heard of them at least, right? Yes, AI performance in the actual part. And so there's a lot of things that we can, we've started with, which we'll go over scope pilot here in a little bit, but also other things that we're going to add as we grow. Victoria, obviously, she's our engineer. She knows more of the ins and outs of that stuff, but and what's coming down the line. But yes.
Yeah, and something to mention about the partnership, we've been working with NVIDIA since almost the inception of research. So we were founded in 2020, as you mentioned earlier, in France by a laparoscopic surgeon. And so it's built with laparoscopy as the core focus. And we've since then expanded.
We were talking about this last night, guys. Do you think laparoscopy is dead?
Yeah.
Far from absolutely not. Laparoscopy is not dead. So whoever has heard that this is the death of laparoscopy, absolutely not. We're not advocating for no laparoscopy, quite the opposite. We're advocating to train our trainees on every aspect of surgery. Laparoscopy, open surgery, robotics, AI, endoluminal surgery, endoscopy. We can do it all with collaboration, right?
Correct. 100%. And we'd love to show you actually really
Let's do
quickly
it.
of how everything comes together. So first, let's start off with just showing you how maneuverable it is. So it's as simple as moving the cart. You have 0-degree radius. You can turn and rotate however you like. It works as, again, it's a compact cart system with 2 arms. What we'd like to hone in on, if you want to come over a little closer, is once you have it ready and turned on, this is the first page that you see.
Yeah. So in initial setup, there are only a few different steps. You just select the surgeon who's going to be operating. Today, we're going to go with the guest surgeon. You would select which procedure you're doing. In this case, we're just going to go with other. And then you choose which side the system is positioned relative to the patient. And then you can immediately move into a pose that's optimized for the scrub to drape. And actually, Kylie's going to show us the draping procedure. So there's only 2 accessories that come with the system. There's a system drape, and then there are the couplers. The couplers come in 2 different sizes, 5mm and 10mm. Once again, compatible with off-the-shelf instrumentation. They come packaged in a carton, and they can be delivered onto the back table.
And you call them couplers. Couplers.
Couplers.
And what the function of that is to enable you to connect the arms of Maestro to whatever instrument you want to hold,
That's exactly
or the
correct.
endoscope, right?
Exactly.
Okay.
Yes.
So is it difficult to assemble that? I mean, it may look intimidating, but I have a suspicion that it's the easiest thing in the world. What do you think?
It's very simple. Yes.
Show me, please.
We have done a lot of work to design it well. So you can see the coupler there. There's a locking mechanism as well as an ejection mechanism and a clip to attach it to the end of the robot.
It's as simple as attaching, hubbing, and locking. And
Wow.
now you're attached.
And that's it.
Yeah.
And you're using just any type of proprietary, any type of laparoscopic instrument there. It's not made by you. It's just any type of instrument. You can couple it to anything.
Maybe 5 and 10.
Any 5 and 10 millimeter instrument. Okay, and that applies to the 10 millimeter laparoscope
Correct. And
or the 5 millimeter laparoscope.
Exactly.
Okay.
So let us show you how to drape. I'm going to move the system back so Kylie can apply the drape to the end of the arms. Again, it's one drape with 2 sleeves to cover both arms. He's going to apply those plastic hoops over the top of the arms. The circulator can assist in pulling the excess drape back. You will pull the hoops all the way down to the base of the arms, just like he's doing. Circulator can grab the excess and attach it to a clip here on the front side of Maestro. And then after, actually, while Kylie is doing this, he has the ability to adjust those arms for his own comfort. So we kept the assistant in mind. We know that the scrub assistants are key team members in surgery. So we want to make this process really easy. And on average, draping takes less than 2 minutes.
That took about a minute, so I was timing it. That's very nice. So easy to do. Only 2 arms. So guys, why 2? Why not 3? Why not 4? Some surgeons ask. What do you think?
Well, we wanted to start with just the most basic fundamentals. So we know that the assistant typically drives the camera and can also apply counter traction with the retractor. So we focused on those 2 needs first, and additional arms are not out of the question.
That could be in the future, but remember, you started this in mind as you wanted the Maestro system to be the perfect assistant to the surgeon. And so it's an assistant robotic platform that will give you feedback eventually with AI capabilities, but who knows, right? In the future, it could have more arms, but at the beginning, only 2.
Yes.
One, can you explain the modality? So one is to hold the endoscope or laparoscope,
That's correct.
and the other one is a retraction type arm,
Exactly.
correct?
Yes.
And one of them is trained to follow you and learn how you move. And so it's almost like the AI learns your moves and it learns to move according to how you move. Okay, so can we talk about that?
It's ambidextrous, so it doesn't, it's up to the surgeon which arm is attached to the camera and which arm is attached to a retractor. It can be either one. You can switch it intraoperatively if that's what you need to do. And so what we'll show you is first the application of the couplers. So Kylie's going to squeeze the clip on the bottom of that coupler, apply it to the end effector of the system. There's feedback that you get immediately. The arm turns from blue to green, which indicates that a coupler has been attached. And you can go ahead and apply the second one in the exact same fashion. And all of this would be done prior to the surgeon being ready for the system. So the draping happens, couplers get attached, and then the scrub can actually move the arms manually into a compact pose, nice and easy.
So all you had to do was just manually push, right?
Exactly.
And it responds. So there's no button, there's no clutch button you need to push.
Exactly.
So it's really intelligent and it just responds to gravity, right?
It responds to the force that you're applying.
To your torque.
Exactly.
That's it.
Exactly.
Very easy. Okay, I like what I see so far. What else?
Okay, so when you come to dock the system at the table, you can actually come on this side. You unlock the system here, down below. Oops, sorry, it's locked. Unlock, rotate, and then you'll see there's a bed guidance feature that shows you just how close you're getting to the table. Once again, we care a lot about the experience for the circulators and scrub assistants in the room. So
a lot of the time it's difficult to know how close you need to be with a robotic platform. Ours is compact and has this level of guidance that shows you where you need to go. So we just need to get that line to turn green. You know, you can push it a little too close and then you won't want to position it there, but you can pull it back into a gray zone and then get it into green. So that's perfect.
Victoria, it looks to me like you're coming from the patient's right now.
Yeah.
It looks like this is a setup for a laparoscopic cholecystectomy. I'm using my imagination based on what I see on the abdominal wall of the model. This is how I like to do it anyway. I put my port in the left upper quadrant, optical entry. That's just my preference. It's not the traditional lab chole that you see where all the ports are on this side. And then we have one for the assistant, one for me, right? I use these two. I'm going to be using articulating instruments from LipsMed, from Arc Essential. We had the laparoscopic articulation laboratory workshop yesterday, and it was a success. So we're going to be featuring that. I'm going to be using articulating instruments. Now, Maestro is going to be using a regular, non-articulating, traditional laparoscopic holder or grasper. And then this will be the 10mm endoscope or laparoscope. And so let's see how you can demonstrate coupling and getting ready for a lab chole.
So Kyle is going to show you, you can actually just pull the arm toward you as you naturally would. You push the shaft of the instrument into the coupler. You're then hubbing it up into the handle and locking that lever all the way in one direction. So now the color of the arms has changed from green to purple. That indicates that there's an instrument attached. And now wherever Kylie moves and pauses for about a second, there's feedback, both audio and visual and tactile feedback on the handle that indicate that the system is now holding. So it senses when you've paused and holds exactly where you leave it.
Okay, can you demonstrate that one more time?
Sure. So it's as easy as grabbing the scope, right? And then holding for that just about a second, and it gives you that feedback that you'll feel in your hand.
It's a tactile feedback.
It's a tactile
almost
feedback.
like it vibrates almost.
Yes.
Exactly.
So there's that audio and that tactile feel that you'll get.
And then it lights
as we're
up.
moving.
Yes.
Yes. And you pull, and that gives you that beat.
Okay.
So go ahead and give it a try.
And just a note, you can choose to turn the audio off and just have the tactile vibration.
So let's say that I change my mind now. Move the laparoscope this way. Okay, I like that. Move this way. I like it. I'm happy with that. You see, that was the feedback. I felt the vibration. It's good. I can be confident that Maestro has the camera now. Now, what about the retractor? Let's say that I want to manipulate that retractor. Take a look at the screen over there. Let's see, Michael. So let's say that we want to move the gallbladder. I'm grasping the gallbladder at the fundus, right? Let's say I like that. Now, Michael, come over here. Show us this arm, and we're going to take a look at how we're going to couple my retractor to the arm of Maestro. Take a look how easy it is, right?
So again, we're attaching it to the instrument. We're hubbing it back to the base of the instrument and then locking it away from the trocar. So that gives us that extra space if we need to hub up against the trocar.
And that's it. Now, you see, I know that my Maestro assistant arm has my grasper. I don't have to worry about it. Let's say that I change my mind and I don't like that retraction and I'd like to do something different. So let's say that I want to retract differently or higher. And how can I adjust the arm in that case?
Yeah, so exactly as you normally would, you'd make the adjustment from the handle.
From the handle, right?
Just move
Let's say
it.
that I want to move this way or whatever. Let's say that I want to go up higher. Okay, I like it. So now I stay still and I feel the vibration and it's perfect. Okay, so it's as easy as just holding for a second, like Kylie was saying, and then you feel the vibration and it's ready to go.
And if you would, as you would be doing a position, you would be standing as a surgeon where Kylie is.
I would be right here.
There, yeah.
I would be right here on the patient's left. We use the American position versus the French position where the surgeon is in between the legs. But this is in the US is usually we're on either side, right?
Yes.
We keep the patient supine, arms, legs closed, and then I'm standing on the patient's left. My assistant is on the right, and then we're ready to go. And then I would normally come in and I would do my operation that way.
And something to point out is around the control of your workflow with the arms, you have one full horizon control always. We're not locking that out for you.
You can always move the camera to whatever angle you like. And then depending on how you'd like to position your arms, the arms for the system also can be manipulated and moved so that you are avoiding any collisions with yourself. So you can come in from above or you can come in from below. So as you're standing, Dr. Oviedo, on the side there, that allows you greater freedom to directly reach over and retract if needed. And now, before we get into the RDCO, we want to actually also highlight ScopePilot, which is the AI-enabled feature, and really showcase how you can control 3 instruments with just 2 hands.
Let's do it.
So let's show you that real quick. So as we have this position, the way you would operate and turn on ScopePilot is by double-clicking our collar button.
Enable ScopePilot, reposition the camera.
It's asking you to identify which arm is with the camera. That ding means you now
Waiting to
identify.
pair.
Now it's waiting to identify an instrument. So now,
Pair to hook.
regardless of your manufacturer, we are able to pair with your hook, your sealer, and your grasp.
Okay.
So these are off-the-shelf instrumentation. Now you can see how, as Kylie is moving the hook,
The arm that controls the camera is moving on its own. See, according to Callie is moving, and the camera is following you, and nothing is controlling it other than
Exactly.
Maestro itself.
exactly. And so as it's paired to the hook, you can see on the screen, there's multiple different instrumentations in the field. But since we had told Maestro that we want to pair with a hook as the most important piece, it will allow you to follow. So as you move your instrumentation, it is now following that.
It's really following you. So that takes away the necessity to have somebody holding the camera, the laparoscope, right?
Right.
Maestro can do that for you.
Yeah.
Exactly. Yeah, and this is actually the first embodiment of AI in a surgical platform. It's exactly why we're partnering with NVIDIA to be able to do the computing on site, on the system live with 0 latency.
And I was telling Tushar that it would be really amazing if the engineers at some point worked out a system so that the retraction arm also had AI capabilities and learn to anticipate, but that could be voice control or whatever. We have multiple ways of doing it, but for now, we have AI capabilities for the endoscope. You don't have to worry about following yourself or having somebody follow you. There is no tremor. It's very steady. You can get ready to go.
Exactly. Yeah.
And you call it ScopePilot. ScopePilot.
It's the first embodiment of true physical AI, which is a major accomplishment from a new surgical standpoint, but also for the future of surgical laparoscopic care. So this allows you to truly embody physical movement that isn't happening under the hood or behind the scenes. You're actually seeing it translate directly in
Real time.
In real time.
How amazing.
And
This
that
is just
what
the
NVIDIA
beginning.
does. Exactly.
It's just the beginning, not the end. It's just how everything started.
And then the entire time, even when you want to take control, you have full capability. So
You can
we're
take
not-
over.
Yeah, you can take over. We're not locking you out of any part of the procedure so that you are capable of going in.
See, I just did it. I just took
Exactly.
over.
Exactly. And it still remembers and still paired to the hook. So now you can continue moving.
Look at it. How amazing. So, Brittany, student Dr. Bass, would you like to demonstrate a little bit of articulation and trying to manipulate like all that?
ScopePilot
Please.
disabled.
You're gonna be on the patient's left, right? You pretend the head is that way, anesthesia. Okay. Always remember the ergonomics, right? Step stool, if you have to have a step stool, whatever you need to do to be comfortable, so your shoulders are not shrugged like this. You have a comfortable position, your neck is not like that or like that, so you have to be very comfortable. So here we go. Here's Brittany, and you're gonna go in with your grasper. This is your retraction grasper, and see how she's beginning to make adjustments. Nice, and you just practice a little rotation with your instrument. So of course, we're combining 2 technologies here. We're combining the Maestro system from surgical with Essential instruments from Lipsmed. And so of course, there is no conflict. We work with all the companies and we are happy to provide free education for all. There is no conflict here, and we all collaborate together. So we want what's the common goal, which is patient care, patient-centered care, improved outcomes and results for the surgeons too. So perfect. And so now if you make adjustments, Brittany, so go ahead and move around in a faster manner and see if the camera can follow you.
Oh, so we turned off ScopePilot,
Okay,
but
so
we can turn it
Let's
on.
see if we can turn it on. Let's do the test. So how do we turn on ScopePilot one more time? Over here, Mike.
So will you
Brittany, will you pull your
Pull the
left
instruments
hand out?
straighten the.
Pull your left hand out.
So something just to be aware of when we mentioned the grasper and the hook and the sealer. A lot of the stuff that our model has been trained on it has not been trained on this particular instrument, but because it is new and it's very it's fantastic with the articulating portion. So
Can we give it a try?
We can certainly give it a try, and
We can test it.
we can test it out live. Yes.
The left.
Left hand?
Yes.
Okay.
So it's been trained on, look at.
I got you.
Okay, thank you.
So you wanna lock it. So remember,
Yes.
little reminder. So this is very unsteady right now, right? So to lock it, you would go with this right here, and then that locks it. Okay, so I'm gonna unlock it. You make it straight, and that's locked. That's locked. Yeah. So you want to train it with your left?
So
Give it a
try
try.
Bearing to it while it's straight. Okay.
Now take a look at the screen or it's pilot.
So something that we would advise first is like here. Once you're ready, so you're going to bring to that. And bring that into
Waiting to pair. Pair to sealer.
So you are
That's
paired to that, but if you take it out
Take it out.
and then come around,
There
There
we
you
go.
and now it will be tracking that, so you can see how it
You
is.
see how the camera is moving now, guys?
Correct. Yes.
Over here, Michael.
And if you rotate it to have the actual
Articulation.
rotate.
Oh yeah, look at that, Michael. Now take a look at the monitor.
So when I go away.
And the camera is following her as she articulates. How interesting.
It's making sure that it stays stably in the center. So yeah, if you keep it like that position and you move it around.
Try moving into the margin.
Yeah.
There we go. So there's a zone in the middle of the screen where the camera does not move. Because we don't want to add too much additional motion.
There's a zone
So
in it.
as long as you are centered, it stays still.
I see.
But if you move out into like down here, for example.
So these are kind of some of the limitations.
Because it articulates. But if we
Yes.
use that traditional, let's use a traditional one now. Let me have just traditional straight stick instruments. So these are some things that the engineers may have to, as we have more articulating instruments coming to the market, the engineers may have to adjust this, but let's use just traditional instruments.
Scope pilot disabled.
And something just to see here, it's very very instinctive to switch between instrumentation.
There you go.
As you go
Traditional,
from it.
traditional instrument, non-articulating.
So when you want to
Waiting to pair.
Waiting to pair,
Pair to instrument.
but now,
as you maneuver that.
okay, yeah, it makes sense. Right. See, now it's following me wherever I go, and we're not moving the camera. It's Maestro all the work. Perfect.
So your traditional.
Traditional works fine.
Implementation is what our current algorithms are trained on.
Of course. Well, that's a little homework for the engineers as we have more articulating instruments, but it's totally doable.
And as you can see, parts of it are already recognizing the shape and the look of that particular instrumentation. So we want to expand the training and the ability of straight stick instrumentation. So as different instruments come online, we're easily and quickly able to learn and build that library and continue extending along.
Okay. It continues to adjust itself and I can do the operation with there's energy. And of course, everybody knows the steps. And for our student doctors, you would begin your dissection in the region of the cystic duct and cystic artery. Skeleton has the cystic duct and cystic artery as the only two tubular structures entering the infundibulum with the liver surface in the background, therefore establishing the critical view of safety. And then after you flip and divide, if you don't perform a cholangiogram, you would then suspend the gallbladder from the fundus up towards the diaphragm and from the infundibulum anteriorly and laterally, right? So you can begin your dissection and your resection of the gallbladder from the fossa all the way up to the dome. And then that's opposite to the dome down approach. But anyway, that's for another time when we do the lab simulation on an organ. We can try that at the end with our Pro-Delphus synthetic robotic simulator organs that we will have on display at the end of the webinar or the workshop. What else can we talk about?
A question for you, Dr. Oviedo, is as you've been teaching and talking about that,
Yes.
how did you feel about what we are seeing here? You've you were able to talk through how a camera is being stable and your retraction is stable. Can you explain a little bit about teaching and
It's
what you
interesting. We were working with our student doctors earlier this morning, and who asked me, was it you, Brittany or Michael? How can you talk and concentrate at the same time? You know, like this is just practice, you know, and we just practice for years. And in fact, one of the things that we teach student doctors and residents is when they're doing a procedure or supervise, we talk to them so that all of a sudden they're going to stop doing what they're doing. And we say, don't stop, continue, and concentrate on the procedure and concentrate on talking at the same time. And it's a skill that you gain with years of practice. But to answer your question, Tushar, it makes my life easier because now I don't have to worry so much about the camera, holding the camera or the retractor. I can actually focus. I can be more relaxed. I can use my instruments, my two human hands. I can do my job and I can teach at the same time. And I don't have to worry so much about having my medical student or my resident do an assistant job. I can actually have them come over here and be the surgeon. So check this out. Instead of having my student doctors or my residents act as my assistant, I can have Maestro be my assistant and I can teach them how to become a surgeon. Now, that's not to say that it's not important to learn about how to assist. Of course, the best assistants in the world will eventually may become the best surgeons in the world. And there's no surgeon that is a great surgeon that doesn't know how to assist. But at the same time, I can take him away from the assistant role. And you're not a camera holder anymore. Now you're learning how to become a surgeon, and I can teach you more tips and tricks on this side where needed. And I can be behind and I can just tell her, yes, that looks good, that doesn't look that good. I recommend going up or down, etc. So does that answer the question?
Yeah, no, that's fantastic. And about the assistant role, when you are assisting, say you have a dedicated PA or you have a dedicated staff member, they're now able to take that mental and physical load off of just holding retraction or visualization. They can work more in concert with you. They can be more proactive, so they're not reaching behind the table or trying to anticipate what you need and being more calm. If there's an emergency or something happens within the patient, you're able to react much faster because you're not having to stretch yourself or your staff too much. And they're able to also be focused on potentially there's a higher need or a longer case that's running over. You can take over and Maestro can really continue making sure that you have stable visualization and controlling your workflow around the procedure.
And Callie, as a financial expert, do you see value in the ambulatory surgery center environment? So this is what in the United States we call it ASC. In other parts of the world, they don't necessarily call it ASC. And so ASC stands for Ambulatory Surgery Center. It's not a hospital. It's not a hospital. Patients cannot stay there. It's just for day surgery. They go home the same day or endoscopy or whatever. And so the reimbursement in the United States is different. It makes sense. It's financially more feasible to patients. The insurance pays well, and they don't have to pay such a large amount of money for the hospital. You're doing a Whipple procedure, no brainer. You have to stay in the hospital. But if you're doing an inguinal hernia, laparoscopic inguinal, why doing it in the hospital? You can just do it at the surgery center, go home the same day, and it's more feasible for the patient, more feasible for the institution. Does this have a role in an ASC model?
Absolutely. I mean, it's focused on those low acuity cases, right? Those gallbladders, the hernias that you're talking about, right? The tubals and
Tubal ligations, non-complicated hysterectomies, more simple hysterectomies.
Yep.
For our colleagues from gynecology, what else? For urology too, urologic procedures. For example, I'm thinking in general surgery, even anti-reflux surgery on simple sliding hydrohernias. We do that at the ASC system. We do sliding hydrohernias, type 1, on healthy patients, they go home the same day, or even sleeve gastrectomy.
Yes.
Remember that with the COVID-19 pandemic, we're doing a lot of sleeve gastrectomy outpatient. Another example. What do you think?
Yeah, no, absolutely. It's compact, right? ASCs, obviously, sometimes they don't have the staff as a bigger hospital will. So this allows you to have that assistance that you can utilize in your ASC, and have your other staff do other stuff. Former scrub tech, I would have loved to have something like this, right? Available so that I can concentrate on my back table, sterility, watching the procedure, making sure that you have everything that you need and not having to focus on holding the camera, holding retraction, and trying to grab my clip applier or any other instrumentation if we're just the two of us. So this really does alleviate, personnel as far as if they're not available, right? Again, it works well with your assistants, and it works well with those times when you don't have assistants.
So in terms of the cost and economics factor, this is really designed to be for the ASC, but it's also designed for an academic facility and a community institution as well. But in particular for an ASC, as you're looking for the lower acuity, and a lot of that trend is moving from the hospital to the ASC, we want to enable more access to care. So you want to look at your reimbursement. You want to look at, from a hospital or an ASC financial standpoint, are we doing it wholly when we're utilizing too complicated of a technology? Is the staff ready, or do they need more training? Or do we have a solution that's ready and able and plug and play type of ready to go? This enables you to come in, get going, regardless of who's there as your assistant, regardless of who's there from the procedure. So you can do bariatric, you can do general, you can do gyne. It enables a lot more.
And Victoria, the level of the compact nature of Maestro allows it to go from room to room in a very easy fashion. It can fit in a small room.
Yes.
Look at this space. It's not a huge lab, but it is a lab. It's a beautiful lab that we try to maintain, but it's not a very large space. And nevertheless, we have plenty of extra space over there, as you can see. Right. So was it designed specifically for that purpose too?
Yeah, I mean, bringing it back to your first question about number of arms, we were really prioritizing making a system that would be compact and easy to move from room to room, just like you're saying. And that's exactly what it does. So you can very quickly detach from the system, remove the drapes, remove the couplers, and turn it over to the next one. So our turnover time, again, less than 5 minutes, just like setup.
Now I have some comments from the audience. Let's see, greetings from Cameroon, all the way to beautiful Cameroon in Africa. Thank you very much, Dr. Emmanuel. Dr. Mongardini from Italy, thank you so much. Dr. Kibir, thank you very much. Dr. Habib, greetings from Arizona, USA. So we have American trained surgeons seeing us from the United States too. It's not just overseas. Dr. Banerjee from Baltimore, Maryland, thank you very much. We have Dr. Josimar Mendez, one of our leaders at TROX, the co-chair of the youth committee. Thank you very much. Dr. Kabiullah Mian from Pakistan. Thank you all the way to Pakistan. So it's late over there. So they're tuning in. Thank you very much. We have Dr. Moscoso. Thank you, Dr. Moscoso. We appreciate you. Dr. Singh, also, thank you very much. And Dr. Muklis, thank you from San Antonio, Texas. So as you can see, it's a really global audience and domestic audience, also from the United States. So we're seeing a lot of surgeons and a lot of traction, a lot of interest in these webinars and workshops. So thank you very much for tuning in. I take advantage of this to invite everybody to Luxembourg. A little parenthesis, I invite everyone to TROX Luxembourg 2026, where we're going to have a phenomenal congress. The call for abstract is already open. You can officially, starting yesterday, you can actually go ahead and submit your abstracts, videos, your podium presentations, your posters, typical categories, a lot of categories, metabolic bariatrics, colorectal, hepatobiliary, oncology, foregut, AI, new technologies, endoscopy. The sky is not even the limit. So I invite you all to register. The registration link is also open. Very affordable prices for everyone. Only 50 euros for medical students and other allied healthcare professionals and students. Very affordable, and I'm excited about the pre-congress courses on robotic surgery, hands-on, and also on endoscopy, therapeutic endoscopy. Some of the best, like crème de la crème of the world, some of the best endoscopists in the world will be teaching. And also, we have the live surgeries. Live surgery at the Centre Hospitalier de Luxembourg, which is a phenomenal center in Luxembourg, where Professor Atagra and Dr. Pascotto are the leaders of top level quality surgical education. So I invite everyone to attend. And there's so much to gain. What do we have to lose? Absolutely nothing. It's going to be a one global family event, and with a lot of opportunities, and hopefully with Moon Surgical as well, so that you can put your hands on Maestro and then you can take a look and have Maestro assist you during surgery. What else can we talk about as we prepare for the second half? The last 20 minutes, we can probably simulate a procedure on our simulator. So can we talk about anything else about Maestro in the meantime?
As we're gonna, so why don't we begin setting up for that and bring that over? Would be great, Dr. Michael, also for you to get a hands on as well.
Yeah.
Something really to highlight while we're setting that through is, so Moon Surgical is,
So pilot disabled.
as a company, we've really been focused on straight stick laparoscopy. And Scopilot is just our first entrant into the AI field. We have a lot more AI capability actively working on, and it's all thanks to NVIDIA living inside the car itself. So we are able to do real-time edge computing and really bring the analysis and analytics to you front and center. The other component that I want to highlight with Maestro as our system, being the AI-powered surgical platform, we've done to date over 2,300 procedures. And that's only over just about 2 years. So we are a small startup, but we are very fast and growing and really looking to expand and move forward across all laparoscopic specialties. And just in the this year alone, the last 365 days, we've done over 1,500 procedures across all monthly specialties. So it's really showing how quickly our impact is being met.
How many procedures?
Over 1,500 in just the last 365 days. This is really when we're starting to take off.
Including metabolic and bariatrics.
Correct, exactly.
So it's not just Foley's.
Yeah.
We're talking about simpler cases and complex cases. That includes colorectal, doesn't it?
Yes, it does. Yes, we have the new color. And we're gonna actually show one of the
I think you guys wanted to try to do maybe an appendectomy or right colectomy, something like that.
Yeah,
We can show that.
And
So what is in the vision? What are we showing here? Of course, this is not a cadaver. It's not a human body part or trunk. This is not biologic tissue. This is, to show if you can get a little closer. This is a synthetic material called neoderma. Neoderma is a proprietary synthetic material or polymer made by a company called Prodelphus. Prodelphus is a Brazilian company that is one of our official industry partners at Trucks, and their information is in our website. If you go to trogss.org or trucks.org, you can go to the website landing page. At the bottom, it talks about our affiliated journals, our industry partners, and you can take a look at Prodelphus. You can click on the website. It'll take you to the website. They're a professional organization in Brazil that exports these incredible simulators. Our center, our ITP center in Nacogdoches, Texas, USA, is the first one that displays this. They call it the LARS simulator for laparoscopy and robotics. Is ideal for that. You can also use it for open surgery. It has all the organs that you can imagine, everything from the diaphragm, esophagus, all the way to the anus. It even has got female gynecologic organs, and so you can even do hysteroscopy, hysterectomy, etc. And even comes back with the male genitalia. So for even our urology friends, they can do procedures on the prostate, on the urethra, seminal vesicles, etc. So there's so much you can do with this. It has pancreas, retroperitoneal organs. My only thing is it doesn't have a well-developed abdominal wall. So that's part of my feedback or critique to the company. And they're working with us so that we can provide, the program directors from the IPP centers can provide the company, Prodelphus, with their critique and their suggestions for improvements so that they can make more models. For example, we need a really well-developed model for abdominal with the rectus abdominis and the obliques and all the organs, right? All the muscles and layers. Right now, it's only synthetic skin, but everything inside is real. I mean, it looks like the real organs. In fact, let me show you. So if we detach the abdominal wall, we use this on the last few exercises and labs that we had. As you can see, we have some sutures. We use it in the lab. Last is the laboratory for augmented surgical training. We have a robotic component where we use the Da Vinci system in the lab, in the hospital. And so our trainees, our student doctors and IPP graduates, they perform procedures. They were doing intracorporeal suturing. As you can see, some of the sutures, they also did adhesiolysis, right? They also did they did a stricturoplasty on the bowel. As you can see, it comes with pathology. We did a bowel anastomosis right here, hands-on. As you can see, there's been work done. It comes with certain pathology like tumors. It comes with appendicitis. As you can see, the appendix looks like it is inflamed. We could do a colectomy. We could do other procedures, etc. We could do something on the stomach. The liver is a little heavy. The gallbladder is right here. We could do something on the gallbladder too. We can give it a try. And as you can see, even the uterus, we have a uterus with fibroids. We have the bladder, etc., etc. You have the colon rectosigmoid junction. So there is so much that we can do based on this model. And in the future, there will be one of these models at every IPP center in the world. And I'm talking about, one more time, Nacogdoches, Texas, USA. There will be another one very soon, hopefully in Florida, USA. We have another one in Mexico City, Mexico, and Guadalajara, Mexico. Another one in Guayaquil, Ecuador, and another one in Florencia, Colombia. That's in the Americas. Let's go across the Atlantic to Europe. We have Luxembourg, France, and Germany. And then let's go to Asia. We have China and Japan and India. And so all of these programs are growing. We continue to become a larger society with more ITP centers so that we can train our trainees for free, no charges. And many people ask why, how come you do not charge? We do not charge because we do not want to charge. We want to do it for free. We want to do it because it's the right thing to do. We want to share the knowledge, and this is who we are, and this is what we do it for. And so maybe we can spend the last 15 minutes demonstrating how to connect one more time. Let's see if we can couple Maestro, and we can simulate a Coley or one of the other procedures. Let's do it.
So earlier today, we saved a pose specifically for showing the hemicolectomy approach for right hemicolectomy. So I'm going to press and hold that pose, and you can see the arms move automatically into that pose. See up there. And then table. Kylie, you can go ahead and connect.
So this is set up, and Victoria, did you set it up to? And by the way, I know some of our audience members are saying that the sound is low. We apologize. Next time we're gonna try to have microphones for each of us. Right now we're just using the phone, but we're improving. We're getting more equipment in the lab to do these webinars and workshops. We realize that the sound is low, but sorry about that. We're gonna try to speak up a little bit, and we'll try to get the phone closer to us so that we can pick up the sound. So are we setting up for a right colectomy, for example?
So, well, it's up to you on what you want to demonstrate, but just to show how easy it is to look from one quadrant to another. So we're looking at the upper right, of course. You can easily look over to the lower right and make an adjustment to the arms if you need to.
Nice.
Here in the upper right.
There's the appendectomy. We can do the appendectomy too.
Yeah. So you can very easily look from one quadrant to another, and this is.
Okay. Let's see. I mean, this is not planned. None of what we've done today is planned. It's spontaneous. So let me ask our student doctors. What would you like to do today? Would you like to do an appendectomy or cholecystectomy or intracorporeal suturing? We did intracorporeal suturing yesterday. What do you want to do today? I look at that organ, it's looking at you right there on the screen. So it looks really, really interesting. So why don't we do an appendectomy, guys?
Okay, so let's do
So, okay, typically for appendectomy, and if you think about it, I like doing the appendectomy just like a right colectomy, but a mini right colectomy. Meaning, what do I mean by that? Easy, just put the ports in a position where you're gonna be ergonomically very, very safe and very comfortable. So you already have the scope in the periumbilical region. You have this port right here, and I think you can do it with this one right here. I mean, why not? So you typically you do one instrument here, one grasper, and one grasper here, right? Cosmetically, but because we already have this, I believe that you can use this port, and you guys can start manipulating the appendix. Do you want to use straight instruments, or do you want to use the articulating ones? Try the straight ones, just to couple with scope pilot. How does that sound?
That's great.
Okay. Who wants to go first? So the first one will mobilize, and the second student will do the transection. I don't have a stapler right now. Hopefully in the future we'll work with companies that provide staplers, but we're just gonna do an old school ligation, right? So let's do that. Okay, go ahead. Typically the patient will be in a Trendelenburg position. Right now we don't have that luxury, but we should do Trendelenburg and with a tilt to the left side so the organs fall, right? And now we can take a look. There you go.
So now you're going to have to, and keep in mind, everyone, student Dr. Abraham is not a resident. He's a third-year medical student from Sam Houston State University. So he does not have experience as a surgeon, but he's learning a lot, and he's great. He's a great, talented candidate to become a surgeon one day. So he does a great job along with student Dr. Bass. So go ahead and grab the appendix. You grab it with your left. Good traction, very, very nice. Look at how ergonomically safe and comfortable he is, right? So he understands the posture is important. The neck is not hyperflexed or hyperextended. He's very comfortable. And look at Maestro. Maestro is already following him and is doing the retraction. If he wanted to change this retractor, by the way, now let's do something different. This is holding something else. Let's say that I wanted to. What is it holding?
Nothing right now.
Nothing right now. Where is it? Where is this one?
Just hanging out towards
There it is.
So it's just hanging by the gallbladder. I see. So let's take it away from there, and let's see if we can do something with it. Family, go ahead and see if you can retract something with it. Yeah, maybe the omentum, Kylie. Go ahead and grab the omentum right there, and big bite, and then retract it. Nice. Leave it there. And so now you can see, Tushar, you can see how Maestro has learned that it wants to keep that retractor in that place. Now, Kylie, let's say that I change my mind and I want to retract even further towards Michael. Go ahead and retract more and leave it. There you go. Maestro is already adjusting itself. Do one more time. So Kylie's going to grab, big bite, and hold it. Leave it there. That's it. Now, Michael, back to you. You can leave it there. Don't worry. It's now let's focus on Michael. Michael, so now you're going to use something like scissors. Do we have scissors, guys? No scissors? We do have scissors. Do me a favor. Let's see, Brittany, in our own laparoscopic regular instrument, right there. Yes. Let's get the scissors.
Something while they're pulling the scissors, how you've been teaching, what we just did.
Yeah.
Do you want to emphasize that again?
Yeah. I mean, look, I'm not even touching anything. I'm just talking. I'm not even operating. I'm just supervising our third-year medical students. So how beautiful. I don't have to worry about holding the camera. Somebody else is doing it. Maestro's doing it for me. It makes my life so much easier as a teacher, as a professor, as an instructor, as an educator. So it's just an example. Okay, so now you have scissors? Did they give you scissors? Where are they? Okay, you have them. So these are the scissors from our own inventory. So go ahead and pretend you have energy. Pretend you have energy and start transecting. So I recommend something different. So I'm going to do something different for you. So I am going to come in and see how I'm manipulating this arm. You let me borrow this. I got it. Okay. Now I got this, and Maestro is going to do a retraction for me. Right there. So all you have to do now.
We need a little bit more force. We can turn on high force.
Do that. Show me that, Victoria. So Victoria's going to adjust the parameters so there's more force.
Arm 2, high force mode enabled.
There you go. See? Nice. Better retraction? How cool. So now, Michael, back at you. You don't have to worry about the appendix anymore. Now you use your left hand, Michael. Your left hand. There. You are going to retract the meso appendix. Toward you. Or close it. Open. You're going to come in here. Close. And now I want you to use your scissors and start transecting the meso. But don't cut the appendix. That's for Brittany to do. Okay? And then pretend there's energy. You can make the sound or something, right? Energy, and then go ahead and cut. Just pretend there is energy there, and then get close to the base of the appendix. No, close to the appendix. Yeah, perfect. See, I'm not even touching anything, right? I'm just talking. I'm instructing him. I'm behind him. So this enables me as a teacher to be able to do my job as an instructor, as a professor, as an educator, right? So don't transect the appendix. That's for Brittany. Okay. Okay, perfect. Leave it there. Now, Brittany, you would normally come in and let's do something fun. Why don't we do something fun? I need suture. So, Michael, go ahead and get me some suture. Bring somebody here. Give me this. Let's do something fun. I think Professor Perez Bonet is going to be very happy to see this because, this is an example of how we teach our trainees. Let's say that you don't have a clip applier. Let's say that you don't have a stapler. You don't have anything fancy. So how can you ligate the appendix? Well, let's just do an old school suture ligature. And we have 6 minutes, so let's do it. Hopefully we can demonstrate in less than 6 minutes.
So I am gonna need, at this point, these are the scissors from our tray.
Yes.
Okay, so we can put this away. Now, I just need the needle drivers, needle drivers. So let's cut this. I need some scissors. Let me have the regular needle driver. Or we can use the artificial too. That's, I'm sure we can use the artificial ones. Yeah.
The driver.
Yeah. Here's a needle. Let's make sure that we put the needle in a place that we know. We can throw it away later. There's a suture ligature. These are the scissors.
You have a driver right there in Michael's hand.
We have a needle driver. Okay, so we have the traditional needle driver, and then we can demonstrate with Arc Essential. So let's just do traditional needle driver first. So I'm gonna go in. Let's say that we're gonna go in, and then I need another needle driver. Traditional needle driver. You can come out with that. Okay. Okay, so this is traditional instruments, right? So typically, what we could do in a case like this is we could potentially. I kind of need the camera a little bit closer, guys. There you go. There you go. Beautiful. Let's see if we can do this. Yeah, right there. Okay. So we can do a little suture ligature and just need a little short. Yeah, that's not bad. So here is the suture, and the idea is just to do a nice suture ligature here. So we can do it in multiple different ways. So 1 loop, 2 loops, etc. You do your thing, and then you can go ahead and grab the other end. Or we can also do it with the articulating instrument. So let's see if we can do it with the other instruments, guys. So let's see if we can do this with the Arc Essential instruments. Okay, so I'm gonna leave that alone. Let's put these back. Okay, so this is just an example that we could have done it with the traditional one. So let's see what happens with Arc Essential. So one more time, let's turn on the lights one more time. With the Arc Essential, we're gonna make it locked. We're gonna go in, the other one too. We're gonna lock it, go in. Okay. Okay, there you go. So now you have the Arc Essential instruments that are able to move and articulate normally. There you go, just like this. Just trying to figure out how to open. Bear with me 1 second. There you go. Open and open. That's it. So now we come for this. There you go. Let's see. Oh yeah, a lot easier, see? Because then I don't have to worry so much about articulation here. Let's see if I can do this. Perfect. Okay. Just like that. Okay. There you go. It gets a little complicated when you don't practice. That's the thing. This is a skill that you have to practice to be able to do this. But now that I have it, you can just do your thing and you guys adjust the camera just a little bit. Go in underneath. Okay. Perfect. There you go. So that's the first throw, right? So just a little suture ligature. And adjust the camera one more time. It's just colliding a little bit, that's all. I'm articulating, see that, guys? So articulation. And then I can even pass it to myself. I can even assist myself and pass it to myself. There you go.
and out. Rewrap. I can let it go. There. We can do more loops. So now, Brittany, after we finish this part, what you're going to do, let's see, one more loop, one more time. There you go. There you go. So I'm going to let go. I'm going to come back. Second loop. We're going to do one more. And what time is it, guys?
1.
Okay, so now, Brittany, you're going to come in. And at this point, you're going to just pretend that we have another loop here. So, Brittany, you're going to come in now. And then you're going to use your scissors and transect the appendix. So I'm going to lock this. Just for the sake of time, we're going to come in and transect the appendix. So hold this.
One thing that might give you some more.
There's one more here. Do you want it? Thank you. Yeah.
Okay, so yeah, just go in with a grasper. Okay. Then you're going to go in with your instrument. Follow the camera. There you go. Open. Put it on tension. Okay, good. And then go above my loop. It's gonna open and divide it. You should have another ligature on the top, but we don't have time right now. So just go ahead and do it. Above. Let's pretend there's another ligature on top, right? So it's double ligature. Okay, good. All right. And that is the end. Very good. Excellent.
I was going to say from both the perspectives of the student doctors, how did you feel about having this retraction and stability with you as you're learning?
I loved it. Yeah, I feel like being in the OR so far, I've been able to be hands-on, but this is a lot easier. He's right behind me telling me what to do, and I'm understanding what he's saying, and I'm not having to worry about anything else. So it's great. This is awesome.
Good. And I mean, it's very simple in terms of allowing me to educate my students and my residents. If you're in an educator in an academic center, I highly recommend it. If you are a surgeon who maybe doesn't have time to teach so much and you just want to make sure you take care of your patients, and surgical education is not your thing at this point, you just want to do clinical care, that's also wonderful. You can work in an ambulatory surgery center environment, and you can be more productive with a system like this. As I mentioned, this is completely for education purposes. We're not getting paid to say this. I say it with complete honesty. I say it because it's what I can appreciate. I see the benefits of this system. I don't say it because I'm getting paid. None of us are. This is the perfect example of collaboration from industry support to do an educational program that will benefit a lot of members, a lot of students and trainees and surgeons in practice. So I highly endorse it. I highly recommend it. Please consider it if you're an educator, if you are a surgeon in practice, if you are a top producing surgeon that wants to take care of your patients, you have high volume. If you are somebody who enjoys teaching and curriculum development, highly recommend it. This is something that you should look into. And I look forward to having the Moon Surgical team at Trucks Luxembourg, hopefully, and at future events as well. And why not? We could do another episode showing, now that we know how to assemble it, now we can do a full procedure such as a right colectomy or fundoplication or even a sleeve gastrectomy, etc. Any last minute words before we finish?
Just one big one is really thank the audience for joining us and tuning in. And really, if you're interested in learning more about Moon Surgical and our platform, Maestro, we're happy to bring this to your institution and have hands-on. It really is designed, as Dr. Oviedo has mentioned, for the academic, for the community, for an ASC. It's for any high acuity, high volume, low acuity, high acuity center that's looking to expand their robotic program if they have one, or build on top of their current straight skin laparoscopic procedures. Thank you. Thanks for having us, and thanks so much for having hands-on and giving us all the feedback. So we appreciate your time.
Thank you, everybody. Thank you, kindly Victoria, Tushar. Thank you very much to our student doctors and moderators, Brittany, Michael. Thank you, and we look forward to seeing you at the next webinar series. Please tune in for January 10th. We're going to have an incredible webinar series, and January 17th as well. The one on January 10th will be with our some of the phenomenal faculty that will be discussing different robotic platforms, the Asian platforms. And January 17th, we're going to have program directors from China, Colombia, Luxembourg, and Germany. Some of our program directors from our 12 centers who will be describing their programs, their IPP programs. So please join us, subscribe to Sir John, our official webinar platform. Please register as a free member for Trucks. It's free. There's so much to gain, nothing to lose. Please consider joining us and serving on a committee. Follow us on our newsletter, Robotic Time Zone, and we look forward to the next time. Thank you very much. Have a great day and evening. Thank you for tuning in.